Hello and welcome to Pain Unfiltered, where we go in-depth into the interventional pain and spine world with some of the top key opinion leaders and executives in the space. We are your hosts, Dr. Patrick Buchanan and Dr. Timothy Deere for this Aspen podcast. Let's get started. I am Dr. Patrick Buchanan, and with me is my co-host, Dr. Timothy Deere. Tim, we just surpassed 10,000 downloads on the Pain Unfiltered podcast. How are you feeling about that?
You know, Patrick, I think it goes back to the commitment you've made to making the podcast really, I think, informative, having great guests, really, and making it interactive and making it topics that helps our members and people that are interested in learning more about spine work and advances in the field, innovation. So I think that's a tribute to you and your work, but also I think, you know, there's this point where you hit a certain level, and based on my reading, where that then launches you to a whole new zone of listeners. So I think this is just the beginning, Patrick. I think that's the first milestone for you and for me is working together here on this Pain Unfiltered podcast. But I see great things ahead, and hopefully as we complete season 2 going forward and into future seasons, we'll see that membership and that downloading continue to grow.
Yeah, thanks, Tim. Obviously, couldn't do it without you and your support, and want to thank obviously all the listeners out there. It's just great to have another platform that the society can use to highlight, like you said, Tim, other members and all the innovations that are going on in our field. And then obviously we'd like to thank all of our sponsors that have been through this season with us, specifically Mainstay Medical, Saluda Medical, Nalu Medical, Medtronic, and Spinal Simplicity. So thank you guys for all your support. And like Tim said, we're going to just keep getting bigger and better. So Tim,
Patrick,
this episode,
Patrick, are you in a classroom? It looks like you're in some sort of grade school classroom. Where are you today?
This is actually our break room in our office. It's very colorful here. You know, we want to promote, you know, good energy here, livelihood. So it's
great. Okay. So just wondering.
And most importantly, it has very good lighting. So that's also why I'm in here.
Nice.
Yes. So Tim, this episode, we're going to be highlighting some of our Aspen members. As you know, with all these minimally invasive options we have now to treat our patients, it's more critical now than ever to have APPs at the front lines that can identify these patients and these pain generators. So today we're going to talk to 3 APPs that not only have had a huge impact in their practices, but also in our Aspen Society as well. So I'd like to introduce Ashley Comer, Casey Grillo, and Morteza Rabii. Thank you all for joining us.
Awesome. Thank you so much for having us.
Thanks for the opportunity.
Thank you.
Absolutely. So we'll go one at a time. Just give a brief introduction of your background and kind of what the setup for your practice. Ashley, we'll go to you first.
Okay. So I have been with Dr. Deere and Dr. Kim since I graduated nurse practitioner school almost 11 years ago. Our setup is outpatient. As an APP, I do have a slightly different role than most. I do scrub every surgery with Dr. Deere. So I love being able to do that because I think that's crucial just to give like a global perspective of everything. And once again, thanks for having me.
Casey, we'll go to you next.
Hi, everyone. I'm Casey. I work at the Spine and Pain Institute of New York in Manhattan. I work alongside Dr. Kenneth Chapman at a large interventional pain practice. We have multiple offices, so we're a large practice. We have multiple offices around the 5 boroughs, 6 physicians. We have 5 APPs, and our model is such that as the physicians grow and their volume expands and they become really busy, then they're provided an advanced practice provider to help them grow and to give more efficient care. So I've been doing this now for 11 years. I've been at this practice for 11 years. Thank you for having me.
That's great. How about you, Mort?
Yeah, so my name's Morteza Rabii. I go by Mort. And I've been a nurse practitioner for just about 5 years now. I've been in practice in Kansas City metro area, and Crimson Pain Management is the practice. I work with Doctors Daniel Kloster and Jason Barnes, heavily minimally invasive spine as well as interventional neuromodulation practice. And, you know, I help manage intrathecal pumps as well as identify patients prior to and post-operatively, work on patient selection, help with some of the diagnostic blocks and preoperative workup. And that's where I really kind of find my passion, is identifying these patients for more definitive treatments, getting them past the continued mill of injections that kind of work sometimes, and certainly the medications that don't quite get them the relief that they really need and the functionality that they need.
Patrick, and thanks for those introductions. And, Patrick, 30 years ago, I started practicing, it wasn't a thing to have an APP as part of your practice. And I brought one into my group in my second year of practice, really, in the end of the first year. And I really think that the role of the APP in my practice has always been very important. But it's not been the way it's been in, I think, a lot of interventional spine practices over the last few decades. It changed dramatically in the last 5 or so years. So I think one of the first things we might want to ask, one of our friends here is really, what have they seen as the role of the APP in the really advancement and the evolution of interventional spine? So Casey, maybe we can start with you on that question.
Sure. I think that, being in practice for 11 years now, I've, somewhat not only experienced the shift, but you could see this shift happening, throughout the states and the country. As healthcare shifts, our role as advanced practice providers, specifically in pain management, become more key, right? We're more integral to the patient's treatment plans. We're identifying patients, we're educating them, we're managing them, we're treating them preoperatively, postoperatively. We're a part of, every step of the process for these patients, and we work so closely alongside our collaborating physicians. And, with that, I think that we're improving outcomes, and we're providing an extra layer of safety and efficacy to our patients. And with that, we're helping our physicians to grow as well.
Yeah, that's great. As you guys mentioned, you guys all come from different practices, have different even roles inside your practice. And here at Aspen, we try to welcome and encourage all APPs and all providers that have different perspectives. So Ashley, I'm going to turn this to you. Why specifically should APPs get involved in Aspen? And specifically, we have the Collaborative Summit in Nashville coming up too. Why should APPs come and join that collaboration?
Thank you. So collaboration is key. Just being there. And we, Casey, Mort, and I connect routinely. I think one of the key foundations of Aspen is just network building, like building your network, getting comfortable. We all have different opinions. We all practice in different areas. We all have different setups, as we've already talked about just in these few short minutes. There's not one meeting that Aspen or anywhere that I've ever been that I haven't learned or taken away one key of change, or like looking at things from a different perspective. Mort is famous for sending us the craziest things we've ever seen. And I love when I see a text in our group and I'm like, okay, what's it going to be today? I would never have that if I did not attend a meeting. And that is one of Aspen's number one, goals, is to build the network, build the collaboration, because without each other, we are not going to grow. We're not going to learn. We're not going to advance the field. We're not going to do things to better the outcomes of our patients without the key foundation of networking and collaboration.
No, great thoughts, and I think everything you said, I've seen that really be taken to heart around our practice, but other areas. You mentioned Mort, and two things I want to mention about Mort, and then I want to ask him a question. One is, Mort's became a heck of a runner. So Mort, I've been watching you on Strava. You're running fantastic. Look for great things there. Secondly, though, Mort's also been involved in, I think the evolution of patient selection with APPs and physicians playing a role to collaborate on who to pick, and APPs having a great role. So for those listening to this podcast, Mort, the APPs in a practice that's now starting to advance themselves more, doing new interventions, bringing in new minimally invasive spine work. How does an APP learn those methods as far as patient selection, who's appropriate for it, and how do you decide between different things in an algorithm? What's your advice for those APPs and those practices that are trying to really evolve into a more minimally invasive spine practice?
No, that's a really good question, and definitely thank you for the shout out on the running. don't know that I will ever be able to follow in your footsteps fully on that. Badwater is going to have to, not quite on my bucket list yet. But as far as like really working on this, looking at how to identify these patients and how do you get trained up, how do you get that education? For me, to a certain extent, I have fallen into that. I had a passion for orthopedics. That's where I worked orthopedic surgery post-operative as a registered nurse. And so I was kind of immersed in that for several years and originally thought that that is what I wanted to go into as a nurse practitioner, assisting in spine surgery, et cetera. So I made it a point throughout my training to kind of focus on identifying these patients, learning these things, even if I was only taking care of them post-operatively. Maybe why is this being done? And then, I saw the light of day and got a job in pain management, which has been very beneficial, I think, for my work-life balance, but also taking some of that information to the table, then making sure that I took the time and had the opportunity to really take time with Dr. Kloster, kind of learn some on the job. Because as Ashley and Casey can attest, none of this is not stuff you get in NP training. Talking to, my PA colleagues as well, this is not something you get. You're trained as a generalist, right? You get out of school and, I can just as easily prescribe a losartan as I can anything for pain. We have to kind of take it upon ourselves. And coming back to what Ashley was saying, that is a great benefit of like the Aspen Collaborative Summit. It's a great benefit of a lot of these society meetings, if you're able to attend them, is that not only are there some fantastic scientific talks, but also just the ability to meet up and collaborate with some of your peers, figure out different procedures, different things that you can do to elevate your practice, and at the end of the day, provide better care for your patients.
Mort, you brought up a great point that, this is not taught in PA school, nurse practitioner school right after you get out. So I'm going to toss this to you, Casey. How do you adopt these minimally invasive procedures in your practice?
Adopting a new procedure can be quite a challenge in a large practice, for a variety of reasons. But it's important to, take on the challenge, right? Because it can change the patient's quality of life. With that, the way that we do it is to first, establish the objectives and the goals, the why. Why are we adopting this therapy? How will the patients benefit? How is it going to add value to our practice? And how will we be impacted? Part of, discussing the why amongst providers is also to create this environment of excitement, right? To be excited about offering something new and innovative to your patients. Once you've clearly defined your objectives and goals, then the next step is to implement a plan, right? Have an actual plan to, implement this process, especially for my office. We have multiple offices, so making sure that, everybody's on board with the plan. Included in that is providing resources and tools and, anything that can help the providers to make this a seamless process, identifying, risks for pushback, right? There's always a resistance to anything new. So addressing that early on can help mitigate pushback. And then educating the team, right? Making sure that everybody's educated, from the physician to the APP to the support staff. Everybody has to have a level of education so that the therapy can be adopted successfully. And then finally executing, right? And with execution comes communication, follow-ups, observation, and supporting your team, making sure that everybody's supported in the way that they need to be. I probably made that sound like it's easy. It's a challenge and it takes a lot of work on our part as advanced practice providers, but it's essential, right? Because we're seeing this evolution of new technology that's, better for our patients and for us in the end. So we have to be on board with change.
So Ashley, let me ask you a question. A lot of physicians may watch this and they hear the three of you talk and they go, man, it would be amazing to have an APP as part of my practice. And so they want to go out and hire someone. And let's say they get that person on board. And as Mort pointed out, in family nurse practitioner training, for example, you may have, other than giving tramadol or something like that, you may have never really had any experience in pain. How do you train an APP when you bring them into integrate them into practice? Well, what's the steps for those physicians who have never had an APP and now want to bring one into their pain practice?
So, as Casey said, she did make it sound very easy. I'll say adopting new therapy in aligns with, adopting or having a new APP. The key is going to be communication. That's the basis of everything. I think, having an open line of communication, taking your APPs on any new therapy that you have so they can see it. Nobody can talk effectively about something if they've never actually seen it with their own eyes. So if you learn a new procedure, let them watch you do the new procedure. If you're doing a different injection, I've never before in school, we've never seen anything that is done in interventional pain. So let them see that. Let them, follow you once a month once they get off orientation or training so that your talk tracks align. Do things that would doesn't only help them, it helps the patients because the patients feel more confident because you have the same talk tracks, you're going down the same algorithm. And then just keeping that open line of communication. I say all the time, when we started in pain, there was kind of the basic, you do injections. If they don't help, you do ablation, then a stimulator. Now it's like drinking from a fire hose. So, if you end up having multiple APPs, it's okay to have one that's more, sees the medication follow-ups and one that is more comfortable image reviews, ordering more advanced procedures, one that is more post-op focused, and that's fine. That's what we're all different. We all have different passions and we're all good at different things. So, just patience and communication will be key.
Yeah, that's a great point, Ashley, and kind of triaging your APPs to guide to their strengths in terms of patient treatment algorithms. We have a lot of industry listening to these podcasts too, and I kind of want to get each of your opinions on this because you guys are KOLs for a lot of these companies and do a fantastic job at APP education at a lot of these training sessions. So just kind of give your experience with industry, how you partner them, and if someone's is an APP and wants to get involved with consulting or research, what's one piece of advice you'd have for them? We'll start with you, Casey, and we'll work our way down.
A piece of advice so advanced practice providers should work closely with their industry partners for a variety of reasons, right? Education being the top priority because they can help educate you and your team. They're set up for that. Understanding, working with them to navigate through, each organization has their own complex challenges that they face, right? So these industry partners can help you to face those challenges to optimize your operations. But with that, as you learn about these therapies that are offered, and you may find that you're having great success with it and it may transform your practice in one way or another. I think that there's this natural progression to feel passionate about it and to want to get the word out to the community and to your colleagues. I know that's, Ashley, Mort, and I all believe in the therapies that we could, the companies that we work with, and our visions are aligned with these companies and their partners. So I think it happens naturally. But with that being said, you have to put some work in to, make the connections and show up to events and society meetings and their training programs to create, that environment. But I highly encourage APPs to get involved. You're only helping yourself and the community.
Mort, how about you?
Kind of echoing what Casey said and building off of that. I mean, definitely you want to be involved. Okay, so I think one of the best things that you can do as an APP or a clinician in general is, you want to stay on the cutting edge. You want to stay up to date on current treatment options that are available. And working with industry does definitely kind of help with that. You're going to be one of the first people that hears about this new procedure. And then, of course, remembering that, look, anybody, APP wise, you have a master's degree, you have a doctorate degree, right? You have this training, and as a clinician, okay, you have a critical thinking ability. Take what you're learning from the industry partners, look it up. Does this connect with logical science, and build off of that? Then, if you are somebody that wants to start educating your peers, spreading the word about these treatments, taking that next step, making sure that you're well versed on what you're talking about, show up, do the homework, and that does help. If you're passionate about a product and you are, um, you know, you can see the good quality outcomes with your patients, your industry partners are going to take note.
Ashley, how about you?
Absolutely. So well said, both Casey and Mort. And as Mort said, I echo them both. I think just be present. You have to put in the time, you have to put in the work, you have to put in the giving up your weekends, you have to give up, family time. It's a good balance when you're passionate about it. You can never just do it to do it. You have to do it because you enjoy it and you are trying to do what's best for your patients. Like I said, every course I ever meeting I attend, I always learn something. But if I didn't attend those meetings, it's not going to be an easy opportunity. It's never easy. I mean, all of us, we are constantly traveling and working and talking and collaborating. So be present, be there. And then there's always opportunities that come up, and the more present you are, your name, is going to rise to the top because people know you and trust you and develop that relationship with you.
No, great thought. So in about 3 weeks from now, and the link will be in the podcast notes, you'll have a summit for APPs and discuss a lot of these new techniques and methods. And then in July, you have an APP section of Aspen in South Beach at the Fontainebleau Hotel. So I know you have a lot of times where you bring people in, bring them to your network and your community. I think it's so important. But my question for each of you, and actually one of you can take it and anybody else can chime in. I talked about the evolution in the last 5 years. We've been much more involved in patient selection. You've been much more involved in patient care follow-up. Actually, you've been involved in the operating room. You've evolved a lot. What's the next 5 years going to bring for APPs and physician relationships, and particularly in our field in the spine? What do you see happening? Any of you have any thoughts on that?
I think there's certainly, there's a need for quality data, right? There's a growing need for it. And Aspen has specifically been at the forefront as including APPs in their research. So I think that Aspen is the leader in that area. And I think that hopefully other societies will follow, an industry involving APPs in research. I think APPs are capable and want to be involved and really want to have evidence, quality evidence to support the therapies that they're offering to patients. So I hope to see more APPs involved in research in the future.
Great thought. You want to add to that, either Ashley or Mort?
Yeah. So, I mean, as Casey said, I think the field is going to continue where the physician is obviously the proceduralist, and the APP is just going to continue to need to become more diverse in ability to identify these patients. We just keep getting more therapies to give better outcomes. And that, once again, drink from the fire hose, is a triage effect of, if you have multiple APPs in your practice, developing or identifying who is more passionate about each therapy, and then changing practice flows, adapting with ever-changing world of medicine. And I think that APPs are just going to continue to be a critical member of the team. And the more physician time in the procedure suite or the OR, the more patients we can help.
Yep. Kind of connecting both of those. So Casey, I love your shout out to APP involvement in research and like quality improvement, and tying in with Ashley's comment about just really making sure that we're identifying patients appropriately for this, myriad of treatments we have. I definitely, since I've been in pain management, there really has been an explosion. There's been a revolution of different procedures available. I think if we look at just interspinous lumbar fusion devices, at last count, there was 45, 46 different devices out there to accomplish arguably the exact same surgical outcome for these patients. 5 years from now, 10 years from now, is there still going to be 45? Is there going to be 46? I think what we may also see over the next 5 years, what I hope to see and enjoy being part of, is data shedding light on which one of these treatments, which treatments are the most optimal for patients. That is something that we as APPs not only can, but definitely should be taking a part in. Again, using our academic background and really focusing in on, look, what are we doing for the patients that's value added? So I think the revolution of pain management happened over the past several 5 years. I think this is going to be continuously an evolution of APP practice as well as pain management in general.
So before Patrick asks the final question, I want to ask you a rapid fire question for each of you. Patrick, I promise it'll be a very rapid question. So Mort, we'll start with you. Of all the procedures you've been involved in, as far as patient selection, patient follow-up, and seeing the patient response, give me one procedure that's your favorite. If you had to say, I really enjoy picking patients for this procedure, whatever it may be, and again, can you give us your favorite? And then we'll go to Casey and Ashley's last, and then we'll have Patrick ask the final question.
And the final question from Patrick is going to be, Casey, why is it S1-DRG? So honestly, my favorite procedure to work up patients and identify on would be SI joint fusion. It is I think it is a remarkably overlooked diagnosis. These patients, they come in, they're generally suffering. I mean, it's pretty significant pain that these patients are having. Selfishly, when I work them up and diagnose them, I look like a genius. But also, I can predict so well. You do well with these diagnostic blocks. You get dramatic pain relief. I'm usually surprised. I'm usually shocked if they come back and they say, hey, look, the fusion didn't help. It is a reproducible procedure. The patients just do well. So I enjoy working that one up.
Great. Casey?
More, you found about T12. So obviously my favorite procedure to select patients for and manage is DRG. If any of you watching are not familiar with Dr. Chapman and his research on DRG, we've had some compelling research, and we're really excited about DRG because it's truly been a neuromodulation device that's been transformative to not only our patients' outcomes, but to our practice as well. So it's a therapy that we're passionate about, and I love to select for.
Great. Ashley?
Well, so I always go for SI, but Mort took it. So it's equal. So I love the outcomes of posterior lateral arthrodesis that we see in our practice. It's something that I always give like, would I have this done to me if I needed it done? And that is something that I would. The outcomes are great. This is just another importance of education. Patient education is the expectation of what it's intended to help, etc. And then just reiterating overall outcomes. So that's mine.
Great. Patrick?
Wow, those are all great answers. I love, everyone's a different kind of procedure for a different pain generator, and all, has great quality of evidence to help our patients. So that's fantastic. So we'll wrap it up. Tim likes to do this. We're going to give one clinical pearl. He likes to do this in all his talks and podcasts. But anyways, one clinical pearl about how you adopt these minimally invasive surgeries. So we'll start with Casey for that.
Communication is my clinical pearl. Make sure that your vision is aligned with your collaborating physician. We're stronger together as a team. So make sure that you're communicating.
Mort?
When you're looking at any of these procedures, I think get confident interpreting, reading your own radiology. but do not forget that you should be interpreting and reading the patient more so than the radiology. That will guide you towards the right diagnosis more often than not.
Ashley?
So education for everybody in your office, from schedulers, authorizing team, front desk, everyone, just because there's always going to be multiple points of contact, and not saying everybody needs the same degree of education, but just a global outlook of things. Because if they get to my nurse before they get to me and they're like, well, should I feel like this? And there's like, I don't know. Then that patient's like, well, what have they done to me? So educate everyone and talk about things, because there's lots of touch points before you specifically get to see that patient.
That's great. I think those are all great recommendations. So Tim, we'll have you post your final thoughts before we wrap this up.
Yeah, no, my final thoughts are, what great APPs to have on the program. Thank you three very much. I think you all bring so much to the table, and in very different practices, but you come to the same concepts. I think I've always said good people tend to come to the same conclusions, and they may get there in different routes. I think the role of the APP will continue to grow. I think the importance is there, and I think that's why it's important that our society continues to teach APPs about all these new methods and the selection, the follow-up, the care. It's going to be really critical, and I really think that it's really good to highlight this portion of our membership, because Aspen really does take this part of our membership very serious and really values your work. So thank you all very much, and for all the APPs listening out there, thank you, and for the physicians who are listening. I hope you are really collaborating the way we should. I think it's important that we listen to the message of communication as well. And to industry out there, I think it's important you understand this teamwork we've created nationwide, and I think it's going to continue to be very viable. So Patrick, that's my final thoughts.
Thanks, Tim. Thank you all for being here. It's been, great getting to know you guys through this society. Casey, Ashley, I've had the pleasure of publishing articles for postoperative care of vascular joint fusion with you. Mort, it's been getting great to know you too. I mean, you guys really have set the bar for APPs, and really looking forward to what you guys have coming up next. So thank you all for joining us. Looking forward to seeing all you guys at the Collaborative Summit in Nashville. And this wraps up episode 8, season 2 of the Pain Unfiltered podcast. Thank you guys for joining us.